Good morning, everyone. Welcome to today's webinar. I just wanted to ask you, there should be something popping up on your screen in just a moment while we wait for a few other people to join us. There it is. If you would just take a minute to complete this one question, this will help us get a better sense of who's participating today. So we'll give that a minute and then we'll go ahead and get started.
Julie, this is Monica. On my screen, the poll is disabled, so I'm unable to click on a specific line.
Okay, I'm not seeing that on my screen.
Organizers and panelists cannot vote, so that's fine.
Perfect.
Okay, I'm going to go ahead and close that poll out so we can move back to the slides and you can begin in a minute, Julie.
Okay. Okay, well, once again, everyone, good morning, and thank you for joining us for the 4th edition of Children's Cancer Cause 2020 webinar series. My name is Julie Taylor. I'm the Program and Operations Director for Children's Cause, and I'll be the moderator for today. The rest of the Children's Cause team is here and will be available to answer questions during the Q&A session at the end. Today's program is focused on childhood cancer survivorship, and we'll be joined by 2 distinguished experts, each of whom are instrumental in survivorship research, as well as providing care for pediatric survivors. We'll be sharing what our organization is doing to help aid in the forward momentum in this field as well. So before we officially start, I wanted to go over a few housekeeping items before I share the work of Children's Cancer Cause. First, for best audio quality, we suggest using your computer's audio controls. If you're listening through your computer but would prefer to join by phone, you can click on the audio options and phone, then click on phone, and a dial-in number will be displayed for you. If you need technical assistance during the webinar, please call 202-487-3270, and that number appears in the lower right-hand corner of each slide if you're having difficulties. Just a reminder that today's call is being recorded and will be available on our website, www.childrenscancercause.org, at the conclusion of today's event. During the course of the webinar, everybody is on mute, but we really do want to hear from you and hope you'll submit questions at the end, which you can do on the questions box there on the right of your screen. And then at the very end of the webinar, you'll be automatically redirected to a post-webinar survey. And if you would please take a few minutes to complete the survey, as your feedback is really valuable to us. Next slide. As I mentioned, I just want to talk a little bit about what Children's Cancer Cause is doing. Our mission is focused on research funding, development of new treatments for pediatric cancer, advocacy for regulatory policies at FDA and other agencies, training advocates through our Kids Action Network, working with our advocates to address state coverage issues, and support for survivors, which again will be the focus of today's webinar. Next slide. Survivorship has always been a core focus of Children's Cause. And as you all can appreciate, one of the great challenges in childhood cancer is, in the experience of childhood cancer, has been the transition to care. And Children's Cause is working on a number of initiatives to address this issue in our programs and our policy agenda. And so, as I said, as you can see from this slide, some of the efforts that we've been engaged in recently. We helped draft the survivorship provisions of the STAR Act and continue to advocate for the implementation and ongoing funding of those provisions. We generated a congressional request for the creation of survivorship standards, which are now being pursued by NCI and the Agency for Healthcare Research and Quality. We successfully pressed for a report on childhood cancer survivorship from the General Accounting Office, which was just issued in August. And we authored a proposal that's been presented to the CMS to test model systems of survivorship care. And we've discussed with federal agencies and state officials. We call this our demonstration project. And we continue to work very hard on that effort. Next slide. And one more thing, just on the previous slide, that we're working, you saw that in one of the images, that we work very closely with the Alliance for Childhood Cancer, the Coalition Against Childhood Cancer, to build out survivorship advocacy campaigns for the coming year. And so why is childhood cancer survivorship important? You all know the answer to this question. But we focus so intently on these issues for our kids because there are growing numbers of them, and they all face serious health risks. So some of those conveyed here, that there are an estimated 500,000, more than 500,000 childhood cancer survivors, and approximately 1 in 530 young adults between the ages of 20 and 39 is a survivor of a childhood cancer. More than 95% of these survivors will have a significant health-related issue by the time they're 45. And these health-related issues are either side effects of the cancer or, more commonly, the result of the treatment. And as you all know, 1/3 will suffer severe and chronic side effects, 1/3 suffer moderate to severe health problems, and 1/3 suffer slight to moderate side effects. Next slide. As part of our survivorship efforts, we've established several incentive awards recognizing and encouraging research and programs for those impacted by pediatric cancers. And the first shown here is the Rosen Award, which recognizes outstanding leadership in pediatric cancer advocacy and medical and survivorship research. The other is our College Scholars Program, which we began offering in 2018 to provide up to $2,000 to childhood cancer survivors. And this helps them achieve their academic goals and provides them with valuable advocacy experience. And we were fortunate enough in this past year to expand our awards to provide support to 7 survivors. Next slide. Another new initiative that we were able to establish with generous support from the Stewart family is the Stewart Survivorship Initiative, and it has several components. The first that we launched is the Survivorship Champions Prize, which is given to recognize a group, program, or institution making significant advances in programs and services to provide lifelong health maintenance for survivors of pediatric cancers. And the award recognizes the importance of the unique challenges associated with post-treatment services for these survivors, especially as they transition to non-oncology care, either as an adolescent or an adult. Our inaugural award this year, which was just announced, is Texas Children's Cancer and Hematology Center's Long-Term Survivor Program. And we're very pleased to have Dr. Gramatges here to share some of the wonderful work that they're doing. I also wanted to share with you that, again, due to the generosity of the Stewart family, we were able to recognize 3 other applicants to this program, the top scoring applicants based on specific criteria. And so those were for program impact. It was the Heroes Clinic at Yale University. For their community collaboration, it was the Next Step Survivorship Program at Children's Wisconsin. And for scalability, it was the LIGHT program at Rutgers Cancer Institute in New Jersey. And so we're very pleased to be able to recognize those folks as well for their efforts. Next slide. So before I turn it over to Dr. Gramatges, my colleague Jess Keene, who's our Director of Communications, is going to share just a sneak peek at our brand new Stewart Initiative website. Jess?
Thanks, Julie. Let's see, we are really excited to preview this new website with those of you on this call. I am trying to pull it up. Hold on. Hopefully. All right, here we go. Thank you. Thank you for your patience. We just made this site public this week, and we haven't shared it out anywhere yet. So you really are seeing it first. The new site is located at www.childhoodcancersurvivorship.org. You're seeing the homepage here. It's designed to help childhood cancer survivors find the best resources out there on late effects and long-term care, find out what's going on in the survivorship policy space, find upcoming events related to survivorship, and find one another to directly connect and engage. So I'm going to show you just a couple of pages on this site while I talk, and then ask you to go explore it more on your own and let us know what you like about it, and more importantly, what it's missing in order to be a real high-value resource for survivors. So for instance, if you click to the transitions page, you'll find information and resources focused around that key step of transitioning from adolescent to adult care. Our goal with the Stewart Initiative is to provide something of a linear guide that meets survivors' unique needs and concerns. So you will see when you reach the end of that page that we direct you to something of a next step, where you can dig in deeper on the particular issues that are most relevant to you and to your journey. You'll see that much of what we offer here, and I know I'm clicking through this all really fast, too fast to really see anything. I'm just trying to give you a brief overview. So most of what we offer is links to other resources. There's really a wealth of terrific information out there, and our goal wasn't to duplicate any of the existing efforts, but instead to package those trusted resources in a way that's easy to find and digest. So there are a lot of offerings to investigate here, but I want to highlight just one other element of this that's new and exciting. So when you click Connect with Others, you'll see here that Children's Cancer Cause has partnered with My Lifeline to offer a safe space for young adult survivors of pediatric cancer who are post-treatment to connect directly with other young adult survivors of pediatric cancer. And you can find this new discussion board resource either right here at childhoodcancersurvivorship.org/connect, or you can go directly to children'scause.mylifeline.org. And it's taken a second to load here because my machine's a little overwhelmed. So the site will walk you through setting up an account, at which point it will look like this. And you can join the discussion board and start a new topic, or you can add a comment to an existing thread. And you'll see here that there's nothing here yet because it's brand new. So we would really love for some of you to be our pioneers with this and to try it out to get the ball rolling. And the great thing about this discussion board is that it's moderated by licensed mental health professionals. So it's truly a safe space to connect. And it is unique in that it is specifically for this population of post-treatment young adult survivors. And once you're set up in My Lifeline, there are a lot of other features available to you, including the ability to create your own blog that will send updates to friends and family who subscribe. And you have full control over your privacy controls and who can see your content. So what you see here in summary is very much a version 1.0. This is a soft launch period where we're sharing this site with just a few folks like all of you and asking for your feedback on what works here and what else this resource needs. So down at the very bottom, you'll see some contact opportunities. You can send us an email or find us on social media or head to our main Children's Cause website. Whatever works best for you. We would love to hear what you think about this site and how we can improve it. Finally, I will click here to the Champions Prize section, which of course is a component of this program. And that takes us nicely back to today's webinar. So as we prepare to hear from Dr. Gramatges, I'm sharing one last glimpse of the Stewart site, which provides more information on the Champions Prize that the Texas Children's Survivor Program just received. And you can visit this page to find out not only more about that award, but also how to nominate an institution for 2021's prize. So with that, I will send it back to you, Julie.
Thank you, Jess. We'll be moving on to the main portion of our program. I just wanted to point out, and Jess, you're better equipped to help this person who's having problems hearing, but they aren't getting any audio. So I just want to move now to the primary portion of our program. And as I mentioned before, we're so pleased to have two leaders in the field of pediatric cancer survivorship join us today. And I will do the introductions and backgrounds for both of them before they speak. And first will be Dr. Monica Gramatges. She is the co-director of research for Texas Children's Hospital Survivorship Program. She's an associate professor of pediatrics in the Department of Pediatrics at Baylor College of Medicine and Texas Children's Hospital. She is a pediatric oncologist and an NIH R01 funded physician scientist. Her research program focuses or explores the role of genetic risk and associated biological factors in cancer therapy related toxicities. Dr. Gramatges is a national leader in childhood cancer survivorship. She is co-chair of the Second Malignant Neoplasm and Cancer Screening Subcommittee of the Children's Oncology Group, Long-Term Follow-Up Guidelines, and co-chair for the Colorectal Cancer Screening Subcommittee for the International Guidelines Harmonization Group. She's also a member of the COG Outcomes Late Effects Committee, for which she serves as the Passport for Care liaison. And after Dr. Gramatges' talk, we will hear from Dr. Emily Tonorezos. She is the director of the Office of Cancer Survivorship, which is part of the Division of Cancer Control and Population Sciences at the NCI. Dr. Tonorezos leads NCI's efforts to address the challenges facing cancer survivors and their families, to prevent or mitigate adverse effects, and to improve the health and well-being of cancer survivors from the time of diagnosis through the remainder of their lives. Dr. Tonorezos came to NCI from Memorial Sloan Kettering Cancer Center and the Weill Cornell Medical College, where she served as director of the Adult Long-Term Follow-Up Program for survivors of childhood and young adult cancers. Her research focuses on cardiometabolic consequences of cancer therapy, childhood and young adult cancer survivorship, diet and nutrition, and care coordination for this population. She serves on the National Academy of Sciences Engineering and Medicine Committee on Childhood Cancer and Disability, the Cancer Survivorship Committee, the Adolescent and Young Adult Task Force, and the Clinical Guideline Committee for the American Society of Clinical Oncology, and the Metabolic Syndrome Guideline Committee for the Children's Oncology Group. So with that, I will turn it over to Dr. Gramatges.
Thank you so much, Julie, and thank you all for the opportunity to talk a little bit about our program and the services we offer at Texas Children's. We're just so honored to have been selected for this year's inaugural Champions Prize, and hopefully I can talk to you a little bit about what we do and about Passport for Care, and provide some more information about all of this. So our mission at the Long-Term Survivor Program, and you can just click next, it'll go through, is to provide comprehensive, integrated, and multidisciplinary care that's designed to maximize quality of life and long-term survival. Also to provide education and support to survivors and their families. We use Passport for Care, which I'll talk a little bit more about later on, to generate personalized summaries of treatment and evidence-based risk for late effects, as well as surveillance recommendations for each and every survivor that we see. And then last, we conduct high-quality research with the objective to predict, prevent, and treat late effects in a diverse population of survivors. Next slide, please. We have a pretty big team, and so I share co-directorship of this program with Dr. Zoanne Dreyer and Dr. Austin Brown. Dr. Dreyer founded our clinic back in 1988, and Dr. Brown is one of our epidemiologists who works in cancer outcomes. And we also see patients through a team that's generally comprised of MD and a nurse practitioner partner pair. At our main campus, we have clinics specific to both non-transplant survivors and transplant survivors. And then we have a West Campus in Katy that sees survivors who live 20 miles east of Houston. And then we also have a clinic in our Rio Grande Valley in McAllen who sees survivors through our TCH partner, the Vanny Cook Cancer Clinic. And we're building increased capacity all over Houston. So we all kind of work together and meet and discuss any challenging cases that might arise. Next slide, please. So as I mentioned, our clinic was established in 1988 by Dr. Dreyer. We're one of the few programs that accepts childhood cancer survivors of all ages, and we are also the flagship clinic for Passport for Care, where Passport for Care was first developed. Our care model has been adapted to serve a diverse and geographically dispersed survivor population. So we offer our care at 3 sites currently in the Houston metropolitan area within a 30-mile radius, and then at our satellite site in McAllen, as I mentioned previously. And thanks to the pandemic, we now also offer telehealth visits. So for our survivors who can't make it to us physically, we can talk to them and give them advice and recommendations through virtual visits. Next slide, please. Our survivors are all at least 2 to 3 years off therapy, and they can be treated at any institution. We don't only see survivors that were treated at Texas Children's. We also accept any insurance status, so we see survivors regardless of their ability, or whether their ability of pay or regardless of their insurance status. And any age, over half of our survivors are older than 16 years. The mean is about 20 years, but we see survivors, our oldest survivor is 65. And of course, being a larger cancer center, we see a wide diversity of diagnoses that we follow into survivorship. Next slide, please. I think another key feature of our program is our diversity. About 60% of our survivors are from the greater Houston area, but really we see survivors from all over Texas. And you can see from the graph there that about half of our population is Latino. So we have a large Spanish-speaking population that we serve, and a lot of our survivors come from the Rio Grande Valley, which is an underserved community, and it's primarily, of course, Spanish-speaking. Next slide. I wanted to offer a little bit of a description of some of the programs that we offer. One of them is the Periwinkle Foundation, which is a wellness intervention for young adult survivors that was established in 2018. And the Periwinkle Foundation offers monthly social engagement opportunities for young adult survivors, now primarily virtual, of course, but offers many opportunities to talk to other survivors and engage with each other, all supported by the Periwinkle program. We have a lot of quality improvement efforts. One of them is early education regarding the importance of survivorship. We feel like it's important to talk about this at the end of therapy, and more we're integrating the importance of survivorship care earlier in the therapy process to make sure survivors understand why it's so important they come for that survivorship visit. And then we have a practice standardization that's across all of our disease-based teams. We're a really big program with 150 faculty, but we've all agreed that it's important that we refer patients to survivorship no later than 3 years off therapy, and that's really to reduce any risk of loss to follow up in that in-between transition period. We conduct quite a bit of research. Some of it is investigator initiated, but we also enroll every survivor or offer every survivor enrollment to epidemiology studies that include germline specimen banking, which also supports the research that we do. And we have now a biobank that's held by our epidemiology team that includes samples from decades of follow-ups from survivors, which is a very rich and valuable resource. And then last, I wanted to talk a bit about Passport for Care. So next slide, please. So Passport for Care was developed by Dr. David Poplack in partnership with the Children's Oncology Group. And what Passport for Care does is it provides a personalized survivorship care plan for every survivor. It uses an algorithm that derives a summary of evidence-based risks and recommendations from the Children's Oncology Group long-term follow-up guidelines, which, as many of you know, is an evidence-based compendium of exposure-based risks and surveillance recommendations. So with Passport for Care, a clinician can enter the diagnosis and treatment information, and Passport for Care will generate the potential late effects related to those exposures and follow-up health recommendations that are specific to those exposures. So it's effectively personalized for the survivor. And that generates the survivorship care plan that the survivor has access to no matter where they are, whether they're at their primary care doctor or at a subspecialist that they see, or that they just want to engage and review their survivorship care plan at home. They can access that through their own portal to the Passport for Care website. Next slide, please. So what were really our goal with that tool and that resource was to provide survivors with mobile access to their medical data, information, and resources that are essential to health and survivorship. And we have quite a number of things in this website, and I have to say kudos to the Children's Cancer Cause for the Steward Initiative website that you all developed. I think it looks fantastic just in the brief tour that we received, so I'm really excited to exploring that more. Similarly, we've tried to address some frequently asked questions, as well as current research opportunities and educational materials with the Passport for Care website. And I've included the link there if anyone would like to explore. I think it's really important to say that we offer Passport for Care free to any clinic that wishes to use it. It's free to any survivor who wishes to use it. We want this to be a freely accessible resource. And it's also fully translated into Spanish because we feel very strongly that it's important that all survivors have access to survivorship care. And being in Texas with the large Latino population we have, that was our first priority. So everything is fully translated. And I think that's all I had in my slides. My last one, I believe, is my thank you slide. And of course, I'm happy to take any questions that anyone may have. I think we're just, I'll just close by saying we're very honored to have been selected for this prize. We plan on using the honorarium provided to support extension of our survivorship services to our underserved communities in the Rio Grande Valley that we partner with, as well as expand other resources and quality improvement initiatives that we've started here. So I think it will open a lot of doors for us, and we're just very grateful to the Stewart family for this opportunity.
Thank you so much, Dr. Gramatges. I will now turn it over to Dr. Tonorezos, who will talk about the work of the NCI Office of Cancer Survivorship.
Hello, this is Emily. I first of all just want to say I really appreciate this opportunity, and it's incredibly exciting for me to hear about the work that Dr. Gramatges is doing and others at Texas Children's, and also, as she mentioned, that the website for AYA survivors of pediatric cancer that was developed by Children's Cause, because I think what we all know is that the loneliness and isolation that a lot of these survivors face is very real, and giving them the opportunity to connect with one another is incredibly meaningful. So I just want to congratulate you on that work. So I'm here to introduce myself and to tell you a little bit about what has gone on in the last year or 18 months or so around childhood cancer survivorship research and what the next steps are going to be. Okay, next slide. So this is my first of two background slides. So I'm a general internist. I was born and raised in Pittsburgh, and I went to Dartmouth. I went to the University of Rochester for medical school, and then came to New York, and I was there on 9/11 at Columbia Presbyterian, where I did a residency and chief residency in internal medicine. And I was very interested in public health and how general internists can work to improve the lives of large populations of people, not just the patient who's in the clinic with you. And that's how I ended up at Johns Hopkins in their general internal medicine fellowship. After that, actually, I came back to New York and I got a job at Bellevue Hospital, and I was working in the World Trade Center Environmental Health Program, which takes care of residents and workers who are around the World Trade Center site on 9/11 and were exposed to the toxic gas fumes and debris from that day. And it was an amazing job, and I was really very committed to that work. But I was incredibly honored and pleased when Dr. Kevin Effinger, who at the time was at Memorial Sloan Kettering, along with Mary McCabe and Chuck Sklar, were expanding the program for adult survivors of childhood cancer and were recruiting junior faculty to come join that program. And so I got the opportunity to move to Memorial Sloan Kettering and to start seeing adults who had survived pediatric cancer. And then just 2 months ago, I came to the National Cancer Institute in my new role. Next slide. And I just wanted to mention actually some of the work that I was doing at Memorial Sloan Kettering. Of course, I was seeing patients, and I continue to see patients through the adult long-term follow-up program. I was also doing medical consults and pre-surgical testing, and starting in March of this year, we opened a program for employees at Memorial Sloan Kettering who developed COVID. And I was running a program called the Employee to Patient Program, which was an incredibly busy and stressful program where we cared for employees who did not have other primary care providers or other people who could help them through their COVID illness. But gratefully, luckily, over the summer, the infection numbers subsided, and I was able to hand that program over to someone else when I came to NCI. But I do get questions about that as well, so I just wanted to include it here. Okay, next slide. I saw right in the introduction slides a mention of the STAR Act, and I'm sure that many or most of you are already extremely knowledgeable about this, but in terms of research for survivors of pediatric cancer, the STAR Act was really revolutionary, and the work to get it passed cannot be underestimated in terms of its importance, because it really transformed the field. And we went from what was more or less kind of a mom and shop pop type operation where funding was gotten, where funding could be gotten from, to a coordinated, highly focused, and extremely motivating and inspiring effort through the STAR Act. And I know that the advocacy work could not have been easy to getting that passed, but it was truly monumental for researchers in the field. And as far as the NCI is concerned, the benefits and the outcomes from the STAR Act are only really just beginning to be, observed. So one of the things I want to mention is that there are funding opportunities that were funded through the STAR Act. There was one in 2019 that had called 19033, and then there's an active one which is open right now, 20027 and 028. And that first funding opportunity was a very unique opportunity because it provided for a UO1 mechanism. And what that means is that there are investigators who work with a cooperative group agreement with investigators inside of NCI so that they can promote survivorship science, and it gives the NCI the opportunity to collaborate with outside investigators and also to have quite a significant say in the type of work that's being done. So what happens is the investigator submits the idea, and then over the course of the funding, the investigator is working with NCI scientists to develop and refine the work that's being done. So I just wanted to go through the first group of, or the awardees that were funded through that mechanism, there were actually 2 separate dates, and I have all of the awardees listed here under the U01 mechanism. So these are projects that have gotten started in the last 6 to 12 months and who are working with NCI scientists. Nina Kadan-Loddick, I saw you mentioned the Yale program. She was one of the awardees. They have a randomized trial of a mobile health and social media physical activity intervention for adolescent and young adult childhood cancer survivors. At Northwestern, they have a project using information technology to improve outcomes for children living with cancer. Really a unique idea, and it's going to be exciting to see what comes out of that work. At Mayo, they have this very interesting study where they're trying to use memantine for preventing cognitive dysfunction in children receiving cranial radiotherapy. Next slide, please. At Dana-Farber, Ann Partridge, who's very well known in the survivorship community, has a web-based patient-reported symptom monitoring and self-management portal for adolescent and young adult breast cancer survivors. I think we already spoke about her, but Karen Serjala at the Hutch has this very cool project, which is an interactive survivorship program to improve healthcare resources for AYA survivors. Kiri Ness, who is a physical therapist, rehab scientist, has a telehealth-based exercise intervention to improve functional capacity in survivors of childhood cancer with significantly limited exercise tolerance. She's at St. Jude, of course. And Wendy Landier from UAB has one of the projects where she's looking at a provider-focused intervention for maximizing HPV vaccine uptake in young cancer survivors receiving follow-up care. And the HPV vaccine, as you know, is prevents cervical and other gynecologic and male cancers as well. And what's incredible is that even in young adults who have survived childhood cancer, the uptake of HPV vaccines is relatively low. So that's a very important study to try to prevent future cancers in that population. Next slide. I also wanted to mention some ongoing work that we're doing with the Agency for Healthcare Research and Quality, which is also funded by the STAR Act. So some of what came out of recent work is that there really is a need to look at the existing evidence and to look actually outside of childhood cancer to see what we might learn from other pediatric scientists and scientists who are working in adolescent and young adult health. So AHRQ does these deep dives into existing resource, and there is actually 3 different large groups of data scientists and other researchers, and we're looking at 3 topics. So the first is reviewing the existing evidence on barriers to care for cancer survivors. Number 2 is models of care for childhood and adolescent survivors, including primary care. And number 3 is that critical transition that Monica mentioned. So when survivors go from pediatric to adult care, obviously a lot happens at the time of that transition, and unfortunately it's a time when we lose a lot of survivors to long-term follow-up. And so that project actually is one of the ones that's looking outside of pediatric cancer research to see what is being done in other populations, for example, children with sickle cell or cystic fibrosis, where the care traditionally has been in the pediatric setting, but as treatment improves, patients are living into adulthood and really require adult-oriented care. And so many of those specialties or practice groups have developed their own methods for transitioning patients to adult-based care. And so we're taking a very close look at what's being done and what we could apply in the childhood cancer setting. Next slide, please. I also wanted to mention just a couple of existing and open funding opportunities. And there was a project I mentioned earlier that was funded through the STAR Act that uses information technology. But I think we all know that things are only becoming more digital, and there are tremendous opportunities to using tools actually very much like the Passport for Care, where we could be engaging information technology to take better care of survivors of childhood cancer. So this mechanism is actually to support small business innovation. And what that means is that you have scientific investigators, maybe at academic institutions, who are collaborating and help developing innovative technology that is actually being developed by the tech world. So it's a way to engage the cutting edge technology and work that's being done, in these small startups and tech businesses, and to orient them to the problems of pediatric survivorship and to stimulate their minds on how we could do a better job of caring for these patients. So the idea here is that there could be digital tools that would be integrated with existing electronic medical records and that would help providers deliver patient-centered, coordinated, and high-quality care to pediatric cancer survivors. So a big part of this is making sure that survivors have that information that's in the Passport for Care, which includes both the treatment that they got and the recommendations for long-term follow-up, and so that is what they're trying to stimulate through this opportunity. Next slide, please. And then this is a slide which this is my last slide. It's just 5 other open funding opportunities related to adverse effects from cancer treatment. And we are in a tremendous inflection point in childhood cancer survivorship research, and I think the funding environment reflects that. And so we see that they're not just the PAR that's targeted specifically for pediatric, adolescent, and young adult cancer survivors, but also funding opportunities to stimulate research in cardiotoxicity, cancer caregivers, another one in information technology around the issue of depression in oncology, and what I think is one of the broadest PARs, but specifically related to adverse outcomes in cancer survivors 19325. So that, I hope, gives you a little bit of sense of the work that we're doing. I think you already know that the energy level is very high, and the importance of the STAR Act and the other advocacy work that you're doing really cannot be underestimated. And finally, and I think this goes without saying, but I have to express my gratitude to the patients and the providers at Memorial Sloan Kettering and through the advocacy groups that have taught me so much about how to be a better doctor and how to be a better researcher. Thank you.
Thank you, Dr. Tonorezos. So now we would like to open the discussion up to the audience. And if you had questions during the speakers' presentations, some of these may have been answered along the way. But if you do have questions, please type them into the questions box that's on the right of your screen, and we will try and answer those questions. So we'll give folks a moment to type in any questions.
We did receive a couple, Julie. Are you seeing those?
No, I'm not. Oh,
Okay.
wait a minute. Let me. Are they in the questions box or the chat box?
Questions.
Because they're not showing up on my computer. So if you could go ahead and read those.
Sure. Yes. Happy to. Let's see. There's this would be a question about Texas Children's. Thanks for the presentation of this relevant topic. Do the researchers of Texas Children's Hospital consider the use of validated prediction models for late effects using pharmacogenics?
This is Monica. That's a great question. We do have a lot of research in that area. The biobank that I was discussing certainly is a very valuable resource for developing risk prediction models in genetics. We are actively working to genotype patients, of course, with their consent, survivors, and looking at correlations between specific genetic markers and outcomes. Our group has published work in that area, looking at neurotoxicity, for example, and obesity, other outcomes common to survivorship. I don't think we're at the point yet where we're actively integrating those genetic risk predictors into a model that's used clinically, but that certainly is an active area of research, and I think there's a lot of effort now to move towards that. And I would hope that one day we can integrate genetic risk in our long-term follow-up guidelines. When we talk about specific risks, I mean, as I'm sure many of you know, while, for example, anthracycline is a risk for cardiac late effects, some people who receive higher doses of anthracycline never develop cardiac late effects, whereas others who receive lower dose do develop cardiac late effects. So what are the factors that moderate that risk? And certainly there's a general consensus that genetics plays a role. I just don't think we're quite at the point where we're using it clinically yet. In survivorship, I would say.
Thank you for that, Monica. Let's see, there's a question for Emily. Well, we've gotten a couple of congratulations to Emily on your new position. And then the question, Dr. Tonorezos referred to pediatric patients often dropping out of long-term care. What are the biggest risks of this happening? And is there anything parents of these patients can do to help prevent this from happening?
Thank you for the congratulations, and that is so generous and kind of you all. And absolutely, there are things that can be done. So first of all, in terms of risk factors, people who live farther away from where they were treated for cancer are less likely to follow up as time goes on. Also, there are some systems level factors like insurance and you know, when the survivor might move away from the parents and things like that, that can make it more difficult to engage in long-term follow-up. And then there are actually some things that are very relevant to how the provider thinks about themselves. I mean, how the patient thinks about themselves. So, for example, if you're a survivor that identifies very strongly with your cancer history, you are more likely to engage in long-term follow-up. At the same token, if you have a medium level of anxiety about your risk for late effects from your treatment, you are more likely to engage in follow-up. If you have too much anxiety, that has a tendency to shut people down and to keep them away from the provider. And if you have too little anxiety, there can be a sense that it's really not necessary, that the diagnosis and treatment was a very long time ago, and that long-term follow-up is not especially important. I think what I would also like to say is that, as Monica mentioned, that Passport for Care is available to any provider who wants to engage with it. And so for people who have moved away from their cancer center or who might be followed up in a general internal medicine practice or in some other type of non-oncology based practice, there are resources available so that the patient, the survivor, or the survivor family can help the provider take better care of the patient. So Passport is one way to do that, and also the Children's Oncology Group long-term follow-up guidelines are a wonderful, very dense, but wonderful resource if if you can point your provider towards those resources. Yeah.
Thank you for that. We have another that might be a little bit similar, and so maybe this is for you or maybe for Monica. This parent asks, her daughter is 3 years out of treatment, and next year she heads to college and wonders whether she should keep her survivorship a secret. Any feelings on what survivors do or should do?
Wow, that's a great question. I think, I mean, my experience, I can only speak to this as a provider. My experience is that every survivor handles it differently. And, but I think a healthy relationship with your history and what you've been through is very important. So whatever that means in terms of disclosure, you know, it might vary quite a bit by personality and things like that, but feeling comfortable in who you are and feeling like your cancer experience is just one part of what makes you who you are, I think is very important. I'll defer to Monica if she has other suggestions for how she advises patients in that setting.
I agree with you, Emily. I think it's a very personal decision. I do feel like it's important for a survivor to feel close enough with their family or with their physician to make sure that their needs are being met in survivorship. And many of the survivors we see when they've gone off to college, they come back to see us during their holiday breaks. They try to schedule it around when they're home, so they continue to engage in the care and surveillance that they need. I think it's a very personal decision whether you talk about it. I think I mentioned we have a very large faculty here at Texas Children's, and a fair number of our doctors and nurse practitioners are survivors of childhood cancer. And some of them are very vocal about it and are very free with telling their patients that they went through this as a child and it drove them to do what they do with their life. And others you would never know because they don't talk about it, but it still drove them to the same pathway in their career, and it's still internally led them to this path to try to support other children who are going through what they went through. They just don't talk about it. So I think it's really every survivor's decision, and where she goes in her life is regardless of whether or not she chooses to tell other people. She has her own inner drivers and intuition that will lead her down her career path. And I think it will be up to her whether she would like to share that about herself or not.
Thank you both for those thoughtful responses to a very personal and hard question. There are still some other questions here, and I encourage you to keep sending them in. If we don't get to your question or if I miss it, we'll make sure we track down answers and circle back with you after this webinar. This question switches gears a bit to the policy side, and I might ask our own policy expert, Sue Emmer, to be on guard here to direct us for an answer here. This question asks, is there any state-based model legislation that's available for review in order to improve the quality of life and reduce barriers to access to care for childhood cancer survivors? Sue? I don't hear Sue. Does anybody else want to try to tackle that? If not, that's one we could send out some responses to after the webinar. I'm going to see what else we have here. Okay, here's another one. I live in the Boston area. My daughter is a survivor, although severely disabled as a result of her journey. I try to be a vocal dadvocate. Is there anything I can do in this area in order to help you out in general? So I'm not sure who that's a question for exactly, but I think it's a really good question of what advocates can be doing. to move the needle on these things.
Wow. So I think, first of all, your participation and your involvement with Children's Cause is, is very important. And standing behind the work that they're doing to support people like Monica and to support policy work as well, I think really cannot be underestimated. And I would say, engaging with a group like Children's Cause in trying to find how you can be most helpful is probably the best advice that I can give. And I think on an individual level, I would just tell you that, as a provider, the patients and their families have been incredibly meaningful in my life and in the work that I do. And so I don't think you can underestimate the impact that you can have on your team and on the people who are working with you and your child.
Thank
Jess,
you for that. Yes.
Hello?
Yep.
Sorry, Jess. George Dahlman. I'm sorry. I was having trouble getting off of mute. To the question about models or state legislation for access to care, that actually is a very timely issue because that's something that Children's Cause is discussing with other family foundations at the moment and coalitions. There are precedents that are established in Medicare that give us some vehicles that we may be able to address this. So in the 2021 legislative session, we're looking towards doing something on the state level, along with some other childhood cancer organizations, that would improve, in particular, Medicaid access, because about a third, and Monica and Emily can probably testify this, about a third of the kids who get cancer are covered by Medicaid. So at least for that population, there may be a legislative vehicle and precedent that we can establish for some kind of coverage, because that is one of the issues is certainly reimbursement. So that is something on our radar that hopefully people who follow the Kids Action Network and other advocacy organizations in the community can look forward to.
Thank
George,
you, George.
Sorry,
Go ahead,
Jess, this is Julie. I just wanted to add to that what George said that addresses both the state model legislation question as well as the gentleman, the advocate, is to check out our Kids Action Network on our webpage that does look at state legislation and talks about things that individuals can do at the state and national level that help in these advocacy efforts and the things that we're trying to do. So I would just encourage people to check that out as well.
Do we have time for another question, Julie, or are we about out?
I think we have time for one more question.
Okay. There was another question here that was related to our conversation around college and transitioning care. And that question was whether you would say it's helpful for the survivors' college advisors to know in case health changes. What do you think, Monica?
Generally, I would say yes, it probably is helpful. I hesitate to say in every circumstance that would be true, because I think every relationship with an advisor is a little different. And I think what I would generally say if I was seeing that survivor in the clinic is that I wouldn't bring it up at the very first opportunity, but if I met with my advisor and felt comfortable with them enough to share that part of my story, that I think it would be helpful for that person to know. But I just think it depends on the context and situation and whether the survivor feels like it's a safe environment to share that information. So I would cautiously say yes, that would be a nice thing for the advisor to know. I don't know if Emily has other thoughts on that, but that's kind of my 2 cents.
I totally agree with your advice.
Okay, well, with that, our time has come to an end. And so I want to again thank Dr. Gramatges and Dr. Tonorezos for sharing all the work that you're doing to advance research and provide care that addresses the needs of those impacted by pediatric cancers. And we are just incredibly grateful for their dedication to their work. And just a reminder, we all recognize the challenges that survivors face, which is why we're doing this webinar and building the programs that we talked about today. So thanks also to all of you who participated today and your continued interest and support for our collective mission, which is curing childhood cancer and ensuring that survivors have long, healthy lives. And just a quick reminder to take a minute to complete the post-webinar survey, which you'll be automatically redirected to. We really appreciate any feedback you have. And if you'd like information about any of the things that we've talked about today, as far as children's cancer cause efforts, please go to our website at childrenscancercause.org. And we do these webinars, as you know, on a regular basis, and we try to bring you topics and speakers that help inform and energize you in your advocacy. And we hope you'll join us again next time. And until then, we thank you very, very much for your participation and your attention. Take care.
Thank you.
Thank you. Bye.